Hello there. So today I'm going to talk about dental cleanings for cats and dogs. Now, for the purpose of this talk, I'm going to be talking about anesthetic dental cleanings. I will have a later discussion about non-anesthetic dental cleanings and why I don't recommend them. But for today, we're going to talk about just a general dental. So when your pet goes to a clinic for a dental cleaning, what's going to happen that day is going to depend on the type of clinic you're going to. A dental at a high volume spay neuter clinic is going to look different than a dental at a general practice. But kind of your general stuff is there is going to be anesthesia involved. Typically your pet is going to be intubated where a tube is passed down the windpipe for this, and that's because there's a lot of water involved with dentals and you don't want that getting into the lungs. They'll usually be hooked up to an anesthesia machine and have monitoring equipment involved with this. But what we're doing in a dental cleaning is we're not just removing the tartar that you see on the surface of the tooth. We are removing what's called the subgingival tartar or calculus, and that's the part that is the problem. So that's going to be the tartar that is underneath the gum line on the teeth. That's the part that causes disease, that causes abscesses, it allows bacteria to damage the gums, those types of things. You really can't get a good subgingival cleaning or scaling with an awake patient. There may be a very small number of dogs that'll tolerate it, but it is very, very rare that an animal will tolerate the depth that you need to be able to clean. Now, most clinics nowadays are going to use ultrasonic scalers, so it kind of vibrates very quickly and shoots water so that it can break off that tartar. You may encounter some clinics that do the kind of older school hand scaling where they take the thing and literally scrape the tartar off. The vast majority of clinics are going to use an ultrasonic scaler nowadays, and then typically they will go in afterwards and polish, because that scaler causes micro abrasions on the surface of the tooth that can actually make tartar build up faster. So if they go in and polish those abrasions afterwards, it reduces the chances of that happening. Some clinics will do fluoride afterwards. Some clinics will actually do antibacterial gels that they'll paint on the tooth or inject under the gum line. Many clinics will also do dental x-rays. This is becoming much more common in veterinary medicine. We are not at a point yet where every clinic offers dental x-rays, but it is suggested. The reason for that is there are a lot of things that you can find on dental x-rays that you won't see on the surface of the teeth. That's actually going to be my next talk, is about like pathology or things that we're looking for in a dental cleaning. Most dental cleanings are going to take the majority of the day, so usually you'll drop them off in the morning and they'll stay until they have fully recovered from anesthesia. So it is a big deal, and there is a lot that goes into an anesthetic dental cleaning for a patient.